Welcome to the Fresh RN podcast. The information contained in this podcast is meant to supplement your existing knowledge and not replace it. Always refer to your state board of nursing, standards of care, and respective institutions' policies to guide your practice. All identifying patient details have been changed to protect their privacy and remain compliant with the Health Insurance Portability and Accountability Act of 1996. Thanks, nurses. Stay fresh.
All right.
Are you good? Do you need to read any more?
What if Katie did this whole next podcast in like a 20-year smoother voice?
What's up, guys? Welcome to the podcast. I am Katie Cleaver.
I'm Alyssa Stafford.
Hey, I'm Elizabeth Mills.
And I'm Kieran McMahon.
We're going to chat today about how to trust your nursing judgment. So we're talking about that period of time right after you get off of nursing orientation, most likely, or towards the end of it, where you've got to trust yourself, trust your own expertise and your experience and your clinical, decision making, and you have to make decisions, and you're working independently. And how do you step into that? How do you do that? Had a lot of messages about that saying, hey, I'm just off orientation. I'm still asking a lot of questions, but I think I know the answers, but I'm nervous and I just don't know how to trust myself, which is scary when you're responsible for patients for the first time on your own and no one's checking after you. No one's double checking anything. It's just you doing stuff. So let's chat. How do you trust your nursing judgment, guys? I did a blog post. I'll put a link to it here. I actually asked this on Facebook because I did get a few Facebook messages. So I asked kind of like the Facebook audience about it. Had some great responses from some nurses, and we're just going to talk about those and our experiences. So the first response was when I was forced to rely on it. So I got to this period where, hey, I actually couldn't go to someone else. I had to just do it and just trust myself. And it was scary, but I had to do it. Did you guys have that experience ever?
Yeah, and it was terrifying, especially when I went to critical care. I mean, it was terrifying even when I worked on the med-surg floor. Because at the time when I was precepting, at the end of orientation, they kind of were basically like, okay, you're done. And I didn't feel like I was ready. And so I went from having 4 patients with a preceptor to being expected to care for 6 by myself. And so I was terrified, no doubt. And I did ask a lot of questions, and I'm pretty sure I annoyed some of my coworkers, especially the charge nurse at the time.
Worth it.
Yeah, I really felt like it was, because I don't want to hurt anybody. Nobody wants to hurt anybody. Everybody wants to be perfect. The reality is that you're not going to be. But, sometimes when there's not anybody around, you really do you have to go with what your gut is. And I remember probably my biggest memory of an example of that was when I was new in the neuro ICU. And I was the only neuro nurse in house. And I was probably 2 weeks out of orientation at that point. So I'd been a nurse for about 1.5 years and had my 8 weeks of training or so. And then, 2 or 3 weeks after that, I was the only one, because at the time we were a really small unit. It was a new neuro ICU. We didn't have that many patients all the time, that kind of thing. And I had a patient who had a ventriculostomy drain. So that's a drain that goes inside the center part of the brain and drains spinal fluid. And it wasn't working. And the doctors knew that it wasn't working. And they were just kind of waiting and seeing what was going to happen with it. And so I'm sitting there thinking, they know it's not working, so I really don't need to call them and tell them it's not working, right? Because they already know that. It's documented that they already know that. It's in the doctor's note. But it was probably about 1 o'clock in the morning, and basically what had happened is the patient's pupil, one of the pupils just kept getting bigger. There wasn't anything else changing, really, because the patient really wasn't doing all that much anyway, but this one pupil kept getting bigger and bigger, and I'm like, gosh, do I call? Do I not? Do I call? Do I not? And finally, I was just like, okay, I'm just going to call, because I'm not going to forgive myself if I don't. And so I called, and of course, the surgeon on call that night was like one of the scariest surgeons ever.
Of course.
And I'm like, well, I also had that epiphany that sometimes I'm going to be wrong, and if he yells, but at least I'm okay, and the patient will be okay. So he came in, and he was gruff and, kind of abrasive, how he always was, but he changed the drain. And when he pulled it out, you could clearly see all the clots along it. And he looked at me, and he goes, "That was a really good call you made." And I was like,
no big deal.
Really? Because here's this scary surgeon who I was terrified to call. And, I never would have expected anything close to a compliment to come from him. And, he told me I did a good job. And it felt really good because I really had nobody else to call at that point. It's in the middle of the night, and I'm the only neuro nurse in the house. So I was forced to trust my judgment.
That's pretty sweet.
So, that's an example when it went great. I'll give an example when it didn't go so great. New in the neuro ICU too, but I had a patient who had a history of diabetes insipidus. And for those of you who aren't familiar with that, it's a condition where there's not enough ADH in the body, so your body gets rid of too much water. And when you're not holding on to enough water, your sodium levels go up in your blood. And if your sodium levels get too high, it can be life-threatening. So this patient had it's very common after pituitary surgery. So he had known diabetes insipidus prior to surgery, and it continued after surgery. And it was high. It was really high, but it had been high. It was a little higher, but I was like, well, they know it. He's got a history of it, and this particular doctor hated to get calls in the middle of the night. I'd been cussed out by him on more than one occasion, but even before I went to the ICU. So I made the judgment of not calling. And, he was mad at me because his sodium really was too high, and it really did get to the point where it could have been life-threatening. And it wasn't, and the patient was fine, ended up being fine, but, got the treatment and the medication that they needed to start bringing it back down again. But, it can go either way. That nursing judgment, I'm glad the good one, like my good scenario where I made the right call happened before the one where I made the wrong call, because, that helped me recognize that sometimes I'll be right. And then here's a perfect example of when I'll be wrong. So you still have, you have to accept both scenarios.
Right.
And I think if I would have had the experience where I was wrong first, it probably would have made me less likely to call, for that drain. So you're forced to make that decision sometimes. And my recommendation would be, you're going to have to, trust your judgment. But what I also mean by that is always err on the side of caution. Yeah. It's better to be safe than sorry, literally.
Absolutely. Yeah. Yeah.
That was going to be my point. I mean, you're right. And also too, like, when you feel like something is wrong, having some objective data. So, a patient is, you're questioning somebody's respiratory status, or, and you feel like something's going on and you need to call the doctor. Well, this is what I see. And I think one of the hardest things I think as a nurse that I have found is, am I going to communicate the message the right way? Am I going to use the right words? Is what I'm seeing really what's wrong or what's going on? And I think with experience, you learn kind of the words and the verbiage to use. But in the beginning, sometimes just say, it's okay to say, I'm concerned. I can't quite explain what's going on, but this is what I see. Can make the difference. I don't know. The more you experience or have these experiences, the more you'll learn kind of what to say in the right way. But in your gut. I mean, you passed your boards. You've been through nursing school. You're not just thrown out there, on your own. But if something is not going the way it should, and if you're wrong, you're wrong. But at least you've taken the time to alert somebody. I don't know if that's the right word to say.
Well, let them know. Another nurse said that she started to trust her nursing judgment when she noticed that her observations were confirmed with increasing frequency.
Mm-hmm.
So it's like, oh, I'm noticing this. Oh, this is right. Okay, I'm expecting this, and this is right. And I think when you kind of get that self-validation, it's a lot easier to trust yourself and your judgment when the things you're predicting come to fruition.
Yeah, and you know, sometimes it doesn't happen right away.
Mm-mm.
Sometimes it might be the next day. For example, a patient with potential sepsis.
Oh,
you know,
yeah.
maybe they're showing some early signs of the septic process going on,
Mm-hmm.
and you know, you alert the powers that be, and you get some basic tests done, and everything comes back normal. So everything kind of carries along. But then day 2, day 3 after all this, they're getting sicker and sicker, and then it's full blown sepsis. And then you don't want to pat yourself on the back, but you learn that, okay, yeah, I'm getting this. I know, I do have an idea about, you know, something that's going on.
And it helps you know what kinds of questions to ask.
Yeah.
You know, if you asked some questions on day 1 and got some tests that were basically inconclusive, did they do something on day 2 differently or day 3 differently that maybe if we'd have done on day 1, we'd have caught it sooner? And so then you learn that, number 1, I was right. I knew something was wrong. But then you take it a step further in knowing what to ask and kind of what to push for better the next time. And the things to look for a little bit better the next time. I mean, I think we've all been there where we've had that something is just not right and I can't put my finger on it. And I hate that feeling, but it's valid.
And it always helps to get another nurse colleague to look at things with you.
Mm-hmm.
Just say, I'm just not sure about this. Come look at this with me.
And then sometimes if the nurse colleague knows that you know what you're doing, they'll say, what do you think?
Mm-hmm.
Because sometimes if you can get to the point where you're asking questions, but you know, you're, instead of like really needing to know the answer and really not sure, you're just relying on someone else to confirm it when you need to trust yourself. You know what I mean?
You're looking for validation.
Yeah, you're looking more so for, yeah, because that that line is thin, I think, when you go from one to the next. And I know when I was a new nurse, I was seeking out that validation when it was stuff I knew. But I was like, let me go ahead and ask. But it's like, oh, wait a sec. You know, so I had some nurses would respond to me and say, no, what do you think? Do you really, you know, and I'd walk through my thought process and they'll say, you know what you're talking about? You know, so that helped me kind of get on my own 2 feet a little bit.
And in orientation, if you've got a good preceptor, your preceptor is going to give you those opportunities because you need to have some of that before you're out on your own to give you a little bit of confidence.
You're taking all of your textbook theoretical knowledge that you know, and real life isn't textbook, right?
Right.
So you're matching up these patterns of what you know in theory, but then they're all shifted and shaped a little differently. So then you're like, well, is this shape? Is this exactly what that is? And you're trying to figure that out on your own. And yeah, I think it's a really, really difficult spot to be in.
Yep.
And I still, to this day, I trust my nursing judgment. I do. But then there's times where I question myself too. And it's always going to be in the back of my mind because I feel like that's a way for me to be safe. And I've had some, you know, not bad calls, but you know, I may have gotten a CT scan done when we really didn't need one. But then I'm like, okay, well, at least I know something's not going on there. I think we just that's another way of putting it into words. But I tell you what, the power of trusting your own judgment and the power of your colleagues backing you up and helping you out can make such an impact on a patient.
Oh, yeah.
And Melissa Stafford and I have seen this recently in action. And the power of a nurse's voice and a group of nurses voicing out concerns can save a patient's life.
Absolutely. You know, because
so don't back down.
Yeah, the patient or the physician or the provider may not see and understand, but then when you can collectively put your nursing judgment together and say, hey, this is not right.
Well, maybe nurse 1 says it a certain way, and nurse 2 says something a little differently that triggers something.
Mm-hmm.
But then nurse 3 says something that really gets their attention.
Yeah.
And they're all saying the same thing, but just maybe using different words.
Yeah.
So it advocacy is a very powerful thing. And I think you're right. When you have somebody that's backing you up, and especially newer nurses, like if I want the nurses that I train to attempt to go to the provider and say, something's wrong, this is what I see. And if I see them not getting the response that even I think that they need to get, then I either kind of ask questions of that new nurse so that they can try and explain their position a little better. Or if I feel like they've done the best that they can at that point, then I can then step in and say, but wait a minute, listen to what she said, or he, listen to what they said. She's saying that the heart rate was 80 2 hours ago. Now it's 120. The temperature is 103. The white count this morning jumped to 16. It was only 8 yesterday. Like sometimes helping the nurse put those things together and helping demonstrating the types of things to say to the provider can make a difference too.
Mm-hmm. Mm-hmm. Oh, absolutely. The next one, someone said, when coworkers started asking my thoughts and opinions, the more experienced nurses, I felt like if they thought I was good enough and that what I thought mattered, then I must, which I thought that was really cool. And we talked in a previous episode about how if you're an experienced nurse, valuing the new nurse and their clinical judgment and asking the new nurse's opinion. I still remember when I was a new nurse and an experienced nurse that I know had more experience and knew more than I did, asked me my opinion for something. And I just felt so valued. And I came to the same conclusion they did. And that was just so powerful to me. I don't know if you guys have had that experience.
It's not showing weakness either to ask, right? It's not a negative thing, and kind of helping to empower the younger nurses. Yes.
Yeah. I think that would be great. And saying those words, I'm thinking about myself in my practice. Like maybe I should just randomly ask some of them sometimes.
Yeah, because
you know what I mean.
Yeah, it's so change your whole day.
Like,
yeah,
just so that they get that validation and that they get that they're valued. Maybe I should kind of make an effort to do that intentionally.
And if one of the things too that you can do that I've done, that because I notice if someone tells me I'm doing a good job, like that just means so much to me, especially if it's someone I respect or someone who I know is better at it than I am. So what I started doing whenever there's a new nurse is if I hear someone else say something positive about them and they're not there, I tell them. Mm-hmm. Like actually the last one I remember very specifically was there was a newer nurse, not a new nurse, but new to the unit, and you were really impressed with them, and she wasn't there, but you were just like saying all this really positive stuff about her. So I went and told her. And I swear that girl's face just lit up like a light bulb. And like I don't know, remembering back to my orientation, when I was in my orientation at the for neuro ICU, a physician complimented me to another nurse, and then it was a notorious like flat affect physician who doesn't give compliments, and that nurse told me. She didn't have to tell me, but man, I still remember it, and that made me so.
And he doesn't hand out comments.
She knows what I'm talking
to
about.
Everybody.
And I was a new nurse, and I was really like not sure of myself, and man, that especially when you're struggling and you're exhausted emotionally and you're constantly questioning if you can do it, and then you hear that someone else unasked, unprovoked, in a conversation when you weren't there, said something positive about you. God, that goes so long.
And you'll never forget it.
Yeah, and I think that we should encourage people when they hear things like that to share them.
Yeah.
Because, I think it does mean a lot to hear it from people who you may not interact with every day. Mm-hmm. Most recently for me, my orientee came from a med-surg floor in a critical care, and we do daily rounds in our unit. And at the beginning, when they first start, I, as the preceptor, kind of directing, so to speak, the things to say and the questions to ask and things like that. And This was a situation where essentially left her alone and had her present the case to the group. It just so happened to be that there was a nursing instructor for a pretty large university, actually, of a nurse practitioner program, was there. And because they had a student nurse practitioner, and was just listening to rounds and, was listening to everybody, of course. But after the rounds were done, she actually sought out our unit leader and said, "Can I give you guys a compliment?" Well, of course.
Yeah.
But what she explicitly said was, "I would not have known that she was a new nurse if somebody didn't tell me that."
Oh, that's such a great. Oh,
And I was like,
love it.
I love it. So, I absolutely made a point to go and tell her that, hear me when I tell you you're doing okay. And this is an example of somebody else who's recognizing that. And I think it did help. But, and sharing those kind of compliments with each other, I think is good, even for somebody who's experienced. Sometimes we all need a little good validation. Honestly,
a reminder of, oh, hey, you're doing a good job.
Yeah.
Like, you're doing great, and we appreciate you. And so anytime you can share that kind of stuff, I think it's great.
Yeah.
I've even had sometimes when like patients will compliment the nurse practitioner or the PA, especially if they're new to the facility. Sharing that stuff, just because they're a provider doesn't mean they're not insecure.
That's true.
We're all humans too. So I don't know. I think sharing compliments is always nice. I don't know. But going to the last point, or actually two more. Another nurse said that she felt like this trusting your own judgment kicks in when you can confidently teach others, which I've really had a validation for myself when I was able to like educate another new nurse or a patient about something or some disease process, and got a really good response. Like that really solidified trusting myself quite a bit. And I had that experience as a new grad, but then I went through it all again when I started critical care. So I don't know if you guys had that experience too.
Yeah, I mean, and that's one good thing about precepting. Is I feel like you learn so much even as a preceptor.
Oh yeah.
Goodness, yes.
Oh yes.
Absolutely.
Because anyway, but yeah, I'll never forget. I was probably a nurse for maybe a year, and I had a family member say, "What's the difference between type 1 and type 2 diabetes?" And I was like, well,
let me tell you.
So I spent like 30 minutes explaining, and I felt so darn good about myself afterwards because I was like, oh my gosh, I do know this stuff.
Yeah, you do. When you're forced to demonstrate it, it's like, oh, wait a sec. Like, it's not just something that's I've read a bunch of times. Like, I actually know this.
Yeah.
And then the last one that I wanted to mention was, time.
Yes.
You're not going to flip a switch and just because you're off orientation, trust yourself. But I think it's important to mention that it's going to take some time. Stephanie D from the Facebook page had a great quote. Wanted to share it. She said, "Time. As it went on and my gut continued to be right about patients, I trusted it more and more. I value being able to ask more experienced nurses their opinion, but I've loved the strengthening feeling of I got this. With each shift and with each health issue, I've caught that could have been missed or had already been missed by others. I'm not perfect, but I do my best and also learn from my mistakes, which also I feel makes me a stronger nurse." So I thought that was great because, it takes time. It takes that consistency from, I think, these various ways of being able to teach others, being right over and over again. When people are coming to you for your opinion and time.
And also, one other thing, keep on with continuing education. Read research articles. Read, especially if you're working in a disease specific or area. Reading what's the latest and the greatest stuff. I know it's not the most entertaining, but I think when you can read what other people are delving into and researching, you'll find that you know more than you think.
Absolutely.
So you have to keep up with. Nobody's going to tell you to go home and do some homework, but you do need to kind of keep on top of reading about stuff.
And that's how you get better too. I mean, I remember
Yeah.
when I first became a member of the AACN, the American Association of Critical Care Nurses, and they send out journals. It's like, oh wait, I get what they're talking about. Like
Yep.
this is pretty sweet, and brought those things up with physicians before, or articles, or I remember one time they had the article in there about how, when you pause tube feeding every time you lay a patient down, that's actually not good, which was totally against what I had thought. And the reason is because you're pausing it over and over all day, and they miss out on nutrition, and the actual risk of them aspirating is very little. So it's worse for them to miss out on roughly an hour of nutrition every day than then endure that slight risk of aspiration, which I thought was super interesting. And I was able to have some conversations with people about it, and that just made me feel just really good about myself, good about my, learning.
Things change in medicine all the time.
Exactly.
So just because you learned it a certain way in orientation doesn't mean that later on down the line, next week, something new doesn't come out, honestly.
Right.
So keeping abreast of all the new information that's out there is important. And also, honestly, by doing that and by seeking out all that information and having a dialogue with providers or families, it builds your credibility.
Oh, yeah.
And so not every research article out there is going to change practice. So there's research out there that contradicts other research. And, so not every new article is going to change the guidelines. But you being aware of what they're trying to figure out and you being aware of different people's viewpoints will help you learn to ask different questions and leading questions, and it will make you a better nurse to do that, because you take that knowledge with you and you share it with others too. So you share it sometimes when you know it, when you're talking to another nurse, and sometimes you don't even realize that you're sharing new information with somebody because it just becomes part of a conversation. So it's well put, Elizabeth. Go out there and research articles.
Yes. Yeah. All right. Do you guys have any other thoughts on trusting your nursing judgment?
Speak up. Don't be afraid to speak up.
Yeah.
Even if you're wrong,
Yeah.
speak up.
Yeah,
Because,
absolutely.
I mean, how many times have things not been said and something not so good happens?
Yeah. Yeah.
So that's our culture right now. Speak up.
Yep. All right, guys. Well, thank you guys so much for listening. Check out freshrn.com/podcast for all of our other episodes and show notes. And if you've got a second, please write us a review. They are very, very helpful for our podcast and helping us continue on. And please subscribe and share with your nurse buds. So thanks, nurses, and stay fresh.
Damn girl, better hit the floor. All the other fellas better run for the door. Stop, drop, and roll with me. I got